The posterior thigh compartment includes three muscles, collectively referred to as the hamstring. Before diving into each of those muscles, I wanted to review the word origin. The word ham refers to the bend of the knee, and string refers to tendon. Interestingly, the word hamstring, when used as a verb, means to cripple a person or animal by cutting their hamstrings. The reason is because the primary function of the hamstring is to flex the knee joint, such as during the gait cycle. When the knee is flexed, the hamstrings also assist with hip extension. For those video game players out there, you'll notice that hamstring is a move in the game Warcraft, which significantly slows the enemy's movement speed. See, who knew video games could teach anatomy? So, what are those three muscles? Well, they are the semitendinosus, the semimembranosus, and the biceps femoris, which has two components. The long head is more superficial and in plane with the semitendinosus seen here, and deeper is the short head, along with the semimembranosus. The posterior thigh compartment is innervated by the sciatic nerve, which originates from the L4 through S3 nerve roots. This nerve then passes through the gluteal region before dividing into the tibial and common fibular divisions. An important sensory branch is the posterior cutaneous nerve of the thigh. Clinically, when the sciatic nerve is compressed by the overlying piriformis, it's called the piriformis syndrome. In order to understand the posterior thigh, we need to know the bony landmarks. The first is the ischial tuberosity, which was mentioned earlier in the medial thigh compartment video seen here. It's the location where we sit. Next is the linea aspera and lateral supracondylar ridge of the femur, where the short head of the biceps femoris originates from. The medial aspect of the proximal tibia is the pes anserinus, which is Latin for goosefoot due to the configuration it makes with all the different muscle attachments there. The femoral lateral condyle, posterior tibial medial condyle, and fibular head are other important attachment sites. The first muscle we'll discuss is the biceps femoris, particularly the long head, which is innervated by the tibial division of the sciatic nerve. It's supplied by perforators from the deep femoral, inferior gluteal, and popliteal artery throughout its course. This muscle originates from the ischial tuberosity and inserts at the lateral fibular head. The function is to flex and laterally rotate the leg when the knee is flexed. Also, it assists with thigh extension during the beginning of gait. The short head is deeper to this, and is instead innervated by the common fibular division of the sciatic nerve. It's supplied by perforators from the deep femoral artery, and it originates from the linea aspera and lateral supracondylar ridge. The short head inserts at the lateral fibular head, and similar to the long head, it also flexes and laterally rotates the leg when the knee is flexed, but it doesn't assist with thigh extension at the hip since it does not cross the hip joint. Of note, the biceps femoris tendon is split by the fibular collateral ligament of the knee. The next muscle is the semitendinosus. It's innervated by the tibial division of the sciatic nerve and supplied by the inferior gluteal and deep femoral perforators. This muscle originates from the ischial tuberosity and inserts at that goosefoot, the pes anserinus. Its function is to flex and medially rotate the leg when the knee is flexed, and it also assists with thigh extension, since it originates from the ischial tuberosity. The last muscle is the semimembranosus, which is membrane-like. It's innervated by the tibial division of the sciatic nerve and supplied by the gluteal and femoral perforators. The semimembranosus originates from the ischial tuberosity, and it inserts at the posterior tibial medial condyle. Its reflected attachment forms the oblique popliteal ligament. Its function is similar to the semitendinosus. Clinically, a Baker cyst, which is a well-circumscribed fluid collection behind the knee, is located between the semimembranosus and the medial head of the gastrocnemius. Another clinical pearl is during the surgery of a tibial plateau fracture. When approaching posterior-medially, the semimembranosus is a useful anatomic landmark. Alright, well that wraps it up. Stay tuned for our next video, the anterior thigh compartment muscles. Please click subscribe for more awesome anatomy videos.